Hi everyone, welcome to today's Mental Health Awareness segment brought to you by Los Angeles County Department of Mental Health. I'm Dr. Nina Tayyib and with me is Dr. Hanu Damerla. And today we're going to talk about post-traumatic distress disorder or PTSD.
Post-traumatic stress disorder or PTSD is one of the mental health diagnoses. It occurs as a result of severe trauma that somebody faces in their life. Trauma is different from a regular stressor or even a severe stressor. Life stressors are bound to happen in life, whether you move from one city to another or your kid goes away to college or something happens to a loved one in your life. In such instances, people develop post-traumatic stress disorder when they either witness or they are threatened with their own death or loss of a limb or something really drastic happens, such as you're involved in an accident. For example, we have veterans who go to war and they face combat and they see so many gruesome incidents in the service of their country, and as a result, a lot of times they come back with PTSD or post-traumatic stress disorder symptoms. Similarly, unfortunately, in kids these days, a lot of times they face severe abuse, like physical abuse or sexual abuse, or they witness things such as domestic violence. In such instances too, where their life is threatened or their trust is threatened, they can develop PTSD or post-traumatic stress disorder. There are other causes as well. For example, various kinds of accidents or various kinds of mishaps that occur that can lead to PTSD.
So for the treatment of PTSD, the main approach is psychotherapy, also known as talk therapy or counseling. As well, sometimes psychiatric medications may also be needed. As far as therapy, the main approach that we found to be very effective is what's called trauma-focused cognitive behavioral therapy, or TFCBT. Through this process, a person has to start looking at the traumatic event. A lot of times people want to avoid it. That can make things worse. So in therapy, they will actually look at the event and see how that traumatic event has affected their thoughts and feelings. And the hope is that by talking about it and thinking through it, they will develop the skills and awareness to sort of be able to control their thoughts and therefore manage those feelings that they're experiencing. There's also some other specialized approaches, but it really comes down to working with a mental health professional who will work with you and really tailor the treatment to what works for you and your specific needs.
There is a role for psychotropic medications in post-traumatic stress disorder or PTSD. However, the mainstay of treatment for PTSD is not medication treatment. It's not like you give a medication and the traumatic stress goes away. That's relevant for kids as well as adults. The medications are meant to immediately relieve the stress, where the kid can come back up to the physiological playing field, or the adult who's having the PTSD can relieve their intense anxiety so that they can participate with their therapist and address their trauma, which is causing the dysfunctionality. So in other words, it is a two-track approach. There is a medication treatment for it, and there's also a therapy approach. But the final say in getting relief from post-traumatic stress disorder symptoms is trauma-focused approach for the symptoms that you're facing. There are many kinds of medications that can help depending on what kind of symptoms you're having. In children and adolescents, one class of medications called the alpha-2 agonists and also some antidepressants can be of help. In adults, a lot of times antidepressants as well as mood stabilizers can help. But the more important takeaway is that one must talk about this, one must make their cry for help, work with the therapist in order to get relief from these symptoms. I hope this was useful in getting an idea as to what PTSD means. I must emphasize that there is hope and there is help available. The key lies in getting a timely evaluation and getting the timely help that is necessary for this disorder called PTSD. Thank you.
If you or someone you care about needs help, call the Los Angeles County Department of Mental Health 24/7 helpline at 1-800-854-7771. Your call is safe and confidential.